Thank you very much for inviting me. Before starting this, दो चीज़ें. पहली चीज़ तो मैं शुक्रिया अदा करना चाहूँगा डॉक्टर उमैर रशीद, who is a one-man army, and Dr. Tariq Mia, with whose support ये possible ही नहीं था. So big clap for Dr. Umair Rashid साहब. I think he is the only person who can hold a successful conference single-handedly. He held a conference last year in Islamabad. More than 54 participants came from 35 countries. All were his friends. हम जितनी मर्जी कॉन्फ्रेंस रेडियोलॉजी की करा लें, किसी में 54 पार्टिसिपेंट्स फ्रॉम आउटसाइड पाकिस्तान नहीं आए और इन्होंने ही ये सारी कॉन्फ्रेंस कराई, उसको अफोर्ड भी किया, उसका मैनेज भी किया, दे वाज एक्सीलेंटली एग्जीक्यूटेड. सो वी आर वेरी थैंकफुल टू हिम दैट ही इनवाइटेड अस एंड ही कीप अस in his team. Number 2, spine and ozone. But what I want to discuss today is ozone is far beyond that spine. It is for our general practitioner friends, all other friends who are doing spine. I am going to discuss few things which actually we are doing here in Pakistan. I want to share that stuff with you कि spine के अलावा भी ozone बड़ा कुछ करती है. स्पाइन के लिए तो हमें कहेंगे जी आप इंजेक्शन लगा दें, बहुत सारी चीज़ें ऐसी जो आप कर सकते हैं. और लुक एट द मिरेकल्स व्हाट इट हैज़ डन. सो इट इज़ बियॉन्ड स्पाइन. सो आई वर्क इन Mayo Hospital, King Edward Medical University. It's an honor for me where I studied. So the my degrees in pain is MSc in pain management and then fellowship in interventional pain management. This is the membership and fellowship in American Academy of Ozone Therapy in Nevada, USA. So what is ozone? This is all for those who do not ozone every day. उनके लिए बेसिक सी चीज़ है कि इससे बेसिकली ऑक्सीजन मॉलिक्यूल है. जब इसको आप एनर्जी देते हैं, एक इसका एटम ब्रेक हो जाता है. When it comes to O2 to O3, that is we call it ozone. Basically it's O2 O3 combination. 97% is oxygen and 3% is ozone. हम आसानी के लिए इसको ओजोन कह देते हैं. The next part, what are the benefits? It is antioxidant. It is improves circulation. It causes pain relief. It causes tissue oxygenation. It causes increased metabolism. Immune system stimulant, minimally invasive, anti-aging, anti-inflammatory. We are receiving patients from Dubai from infertility clinic. अब infertility clinic में ओजोन का काम है. The high-end infertility clinics in Dubai, when they diagnose, they say that few of the embryos do not implant because of the tissue oxygenation, or they call it oxidative stress. And you know what they advise for the treatment? Ozone therapy. They come to us from Dubai for getting their treatment and we do the oxidative stress for them and they are very successful. There are very few centers in Dubai, those who are doing oxidative stress ozone therapy. We are one of them which are doing in Pakistan. So, routes क्या हो सकते हैं? Subcutaneous injections, ozonated oil, IV infusions, autohemotherapy, इंट्रा-आर्टिकुलर, इंट्राडिस्कल एंड इंट्राडर्मल. आप इंट्राडिस्कल बहुत नाम सुनेंगे भी. मैं इंट्राडिस्कल के अलावा बात करूंगा आपसे. सो थिंक बायोलॉजिकली, ओजोन डज नॉट एक्ट एज ए ड्रग. इट्स नॉट ए ड्रग. It works by stimulating the intact biological system. So we are not giving any drug to the patient. We are stimulating his or her biological systems. So the ozone generator, this is what we are using. Ozone को इस तरह भरते हैं. This is one of the generators. जो भी बाहर भी डिस्प्ले पे है, इस तरह ओजोन उसको फिल किया जाता है. इसीलिए we use it fresh. आप इसको कैरी नहीं कर सकते, आप इसके इंजेक्शंस नहीं बना सकते, आप इसको किसी और जगह पे लेके नहीं जा सकते. This is how it is used. So we can use it in subcutaneously, we can use it in the joints, we can use it in the spine, we can. So अब आगे फ़ायदा क्या बताया मैं आपको दोबारा. So it strengthens your immune system, kills bacteria and viruses, detoxifies your bodies, reduces inflammation, anti-aging, increases energy and can kill cancer organisms, cancer cells. इंटरडिस्कल ओजोन इंजेक्शन आपने देखा, अभी बहुत सारा आप देखेंगे, हम डिस्क के अंदर लगाते हैं, दैट इज इन द लंबर डिस्क, वेरी इफेक्टिव. वी हैव डन, most of the cases are being done by Dr. Umair Saab. We have done more than 90,000 cases of these disc disease in Pakistan till now with the 75 to 85% success rate. We have presented our work throughout the world. The last I presented was in Istanbul just a few days ago. The next one is in Dubai on 28th of this month. So look at the difference, and we do use mostly the angiofluoro. So this is the first session. After second session and the third session, and she is a doctor working in Riyadh. She could not walk, she could not work. Now she's actively doing all of her surgeries. So it's not only the lumbar spine, we are looking in the cervical spine also. Very effective. All those patients have been asked for cervical surgery with all those pros and cons of surgery, but this is single step, one step process. More than 5,000 cases of these spine surgeries, these interspinal discal ozone of the cervical spine is being done here in Pakistan, and I think Dr. Umair is one of the persons who might have done the most cases in the world. So what else can be done? So this is the different technique what we can do. Not only interdiscal, we can give periganglionic injections, transforaminal injections, medial branch block, facet joint injections, rectus spinae blocks, pulse radiofrequency of facet joints, SI joints, and piriformis blocks. It all can be done, and if these are being done here in Pakistan as per the requirement of the patient, के patient को ज़रूरत क्या है, हम इसके साथ ओजोन के साथ और क्या कुछ कर सकते हैं. Then autohemotherapy, where blood is drawn, mixed with ozone, put back into the bloodstream. It's a matter of 1 hour. Ozone introduced by parenteral route does not only activate lipid exchange, but also initiates the mechanism of natural processing of the patient's own energy resource fat. We are receiving patients from throughout the world, not only for the diseases, but also for the well-being. आपकी स्किन के लिए, आपके बालों के लिए, आपकी वेलबींग के लिए, आपकी फिटनेस के लिए, आपकी एनर्जी के लिए, आपकी इम्यूनिटी के लिए, there is nothing better tonic than this ozone therapy which we do. And for one disease I will share one case. This is ozone is allowed to mix with the blood for a period of time. The ozonated blood is then intravenously infused back into the same patient, and ozonated blood can be much brighter in color. Look at the blood with the ozone. More than 60,000 transfusions are being done every day in the world. Many celebrities of the world, they're doing before any of their performances, they are using this procedure. And look at this patient. This patient came from Medina Sharif. He is a psoriasis patient. This is the way he came. And after that, few sessions, and now he's like this. What we did is only autohemotherapy. No other medication was given. This just a few days ago. Now he's back to Mashallah Medina Sharif. This is how he came, this is progressed, and this is the end result. Another, ye usi ke, look at his arm, and just look at his arm. This case is being done in Pakistan by ourselves. हमने खुद सारा case किया है. Look at his back, now like this. Just ozone therapy, just autoimmunotherapy, nothing else. Few sessions. So for fibromyalgia, so many females come with us with back pains, with body pains, who do not get better with any injections, who do not get better with any treatment, because fibromyalgia do not come in any investigation. You do a CT, you do an MRI, you do an ultrasound, you do any blood test, no diagnosis of the fibromyalgia. It's a clinical diagnosis. What we do with the fibromyalgia, it can cause fatigue, brain fog, depression, chronic widespread pain, muscle joint issues, and digestive issues. What we do an ultrasound, we localize the trigger points, we inject ozone into the trigger points, and that's it. Amazing results like magic. Jadoo ki tarah ke result. Many anchors are doing Hoji performances in working here in many TV channels, and many celebrities. I have personally done all those procedures, and now they're doing everything, they're doing very well. Then migraine. In migraine, we have done more than 500 cases with ozone. Absolutely clear, absolute results. Patients are no need of any steroids, no need of any medications. So it's a throbbing pain, confusion, trouble making, nausea, vomiting, stuffy nose, dizziness, face and neck pains, mood swings, sensitivity to light, vision distractions. So trigger points are so many, but हम क्या करते हैं? This is how we get them treated. That's it. You apply on the skin, and that's it. You do not have to inject more than 500 cases till yesterday. We have done a lot till yesterday. Last night we kiya हमने. Patients are coming from throughout Pakistan. जिसको migraine होती है वो दुनिया के किसी मौके से भी आने पे तैयार हो जाता है. So we do a combination. Either we do this procedure or we do the autoimmunotherapy. Then vitamin therapy. So with vitamin therapy, IV vitamin therapy, yes, it is done for the rejuvenation. We are using ozone with this. Again, with very good results. In cosmetology, so it's not only pain, it's aesthetics also. So we have used ozone in aesthetics also. It is recognized, again it is done throughout the world. Ozone is a unique agent preserving and restoring the natural body and health of the skin. Ozone therapy does not mask defects of the skin. It does not mask. हम उसके ऊपर कोई mask नहीं चढ़ाते. But normalizes its natural function and stimulates its own growth. Look at the fat which is gone. It takes time, it takes few sessions, but it is gone. And how it helps? Improvement of microcirculation, oxygenation, intensification of the lymph drainage, and energy supplies of the cell and proper trophism. The difference of ozone therapy from other cosmetic remedies, फर्क क्या है? बाकी भी तो सारे करते हैं. आपने क्या कमाल कर दिया? It is dual action from outside and from the inside that lead to the normalization of the trophism. It gives oxygenation, it gives moisturizing, protection and exchange, restoration of the skin. It helps to achieve general cleaning, sanation, tonation, and not only, it's not a temporary cosmetic effects, long lasting effects. For acne, telangiectasias, outgrowth hairs. So many such cosmetic problems are representing the internal state of subject. Hence, this should be treated not only from outside but also from the inside as well. So ozone therapy भी इसी तरह ही करते हैं. Ozone therapy is used in the form of local ozone injections into the inflammatory areas. कैसे? Skin starts fading after 35 years. All those young females sitting here. It shows great benefit by rejuvenation courses of ozone therapy in the form of subcutaneous injections in the place of wrinkles, localizations and other places with manifest skin fading. हम इसको करते कैसे? Look here. I'll show you the cases. This is how it is done. One of my staff members is doing this. It comes to the stimulation of the protein synthesis, including its own collagen and elastin, and increasing the regenerative potential and proliferation of the skin layer. All those crow feet are gone. Ironing of the wrinkle, increasing the skin turgor. This is one of our major, एक बहुत बड़ा ब्यूटी पार्लर है, उसकी ये मैनेजर है. Big name. She came with all this. सारे कुछ कर लिया, तमाम लेज़र लगा लिए, सब कुछ कर लिया, but she was not getting better. She said कि मैं तो किसी के महफिल में भी नहीं जा सकती. Done by her own hands here, and she still 1.5 साल हो गया. She's still like this. All these pigmentations gone, just with ozone, nothing else. ये सारे कर सकते हैं. हमारे जो जीपी दोस्त बैठे हैं सारे, अगर वो करना चाहे तो वही सारा कुछ कर सकते हैं. ये इसके नीचे, स्किन के नीचे निशान थे. They are gone. So infiltrate, softening, decrease in swelling, decrease in exudation, decrease in hyperemia. But this is not the end. जो क्रक्स है आज के लेक्चर का वो ये है, this is not the end. This is the beginning. We have a way forward right now. और वो हम क्या कर रहे हैं? This is what we do. Exosomes, stem cells. We are combining them with ozone with amazing results. As a part of the student of the American Board of Regenerative Medicine, we are doing a lot of stuff. You need to be a diplomat in this. So regenerative medicine is the branch of the medicine that develops methods to regrow, repair or replace damaged or diseased cells, organisms or tissues, organs or tissues. Regenerative medicine include the generation and use of therapeutic exosomes. अब मैं आपको बताऊंगा exosomes होते क्या हैं. And stem cells along with the tissue engineering. So these are the cases which done by us. Exosomes are small extracellular vesicles that play a significant role in intracellular communication. ये cells नहीं हैं, they particles हैं, vesicles हैं. They take the message to the concerned organ within the cells and are released into the extracellular environment. They are typically around 30 to 150 nanometers in diameter. We have done so many cases of intra-articular exosomes with ozone, with PRP. So not only exosomes, they work much better when they're combined with PRP and with ozone. We have done a lot of knee injections especially for this. ब्रेन एंड स्पाइनल कॉर्ड स्ट्रोक, अगला काम जब आता है दैट इज स्ट्रोक. हम सब चाहेंगे कि स्ट्रोक पेशेंट्स को हम ट्रीट करें. स्ट्रोक पेशेंट के ट्रीट करने में जो एक्सोसोम प्ले ए मेजर रोल. So we can give exosomes IV, we can give with the autoimmunotherapy, and we can give these combination can give very good results. So there are papers on this. Then exosomes and pain, जैसे मैंने आपको कहा कि knee arthritis में तो हमने खुद काफ़ी सारे पेशेंट्स किए हैं. So we combine this ozone with exosomes and PRP with very good results. 2 से 3 महीने लगते हैं. The cartilage start regenerating, patient start feeling better. Most of the time when it is a grade 3 osteoarthritis, you may not need surgery. Dr. Fiaz is sitting here, he has good experience in all these stem cells and exosomes. You will see how much things can be done. And then renal parenchymal disease and exosomes and ozone. ओजोन की हम ऑटोइम्यूनोथेरेपी करेंगे फॉर दोज रीनल पैरेन्काइमल डिजीज. रीनल फेलियर के पेशेंट्स को आप एक्सोसोम दे सकते हैं. कैसे दे सकते हैं? आईवी दे सकते हैं. यू कैन गो टू द अल्ट्रासाउंड, go to the renal parenchyma and inject. You can do the angiography, you go to the renal artery, go inside the renal tissue and inject. Very good results. ये सारी दुनिया में आजकल इसके ऊपर काम हो रहा है. Then liver parenchymal disease. Still working, still research is going on, but this is an avenue for the future. ओजोन हम सिर्फ डिस्क में नहीं लगा सकते. ये ऑल ऑटोइम्यूनोथेरेपी एंड देन लोकल एप्लीकेशन ऑफ द एक्सोसोम्स एंड ऑल रीजनरेटिव मेडिसिन इट कैन हेल्प. एंड देन ऑटिज्म. सो मेनी पेशेंट्स ऑफ ऑटिज्म. ऑटिज्म के लिए हम ओजोन जो देते हैं दैट इज इंट्राट्रांस रेक्टल देते हैं. इसको रेक्टल इंसफिलेशन कहते हैं. रेक्टम के थ्रू दी जाती है ओजोन बिकॉज इट्स एब्जॉर्ब वेरी अर्ली. उसके साथ भी कंबाइन देम विद एक्सोसोम्स इट गॉट वेरी गुड रिजल्ट्स. It's again done in Pakistan in few centers. हमारे इसमें बहुत ज़्यादा experience नहीं, but again I'm sharing that this is the avenue for the future. Then male infertility. Patients do come with erectile dysfunction. We have done more than 200 cases of erectile dysfunction with ozone therapy. We call it a P-shot. With PRP, with ozone, and we have done few cases with exosomes also. Again regenerative medicine, again with very good results. It's just being done in Pakistan here. हमने को 200 केस किए हैं यहाँ. Then female infertility, especially premature ovarian failure. You can inject these exosomes directly into the ovaries through a laparoscope or through transvaginal ultrasound, and then you augment with autoimmunotherapy. They gain very good results. Oxidative stress का तो मैंने आपसे पहले अर्ज कर दिया. So conclusion is that the ozone therapy is a very effective treatment in many areas other than spine. So it not only works outside the skin but done through various routes, making it more effective, safe and economical treatment for many body conditions. Thank you very much. Sir.